All right, we are live. I'm going to tweet it out. I'm going to see if he can see us now. Huh. He said he can't see us. That's weird.
That's bizarre. Now I'm blaming StreamYard. Now I'm blaming them.
Like even on the thing, it says, in StreamYard that we're live, but I don't know what's happening.
That's odd.
Give me just a second. Oh, it says we're live. On YouTube, it says we're live. Let me click on it.
I can see you guys. We got a viewer, confirmed viewer.
Oh, okay. Well, that was a delay. Okay, cool. They said they can see us. Okay, cool. All right, we are live. Hey guys, welcome to Sabby Saps podcast. I'm your host, Sabrina Salvati. I have a cool panel lined up this evening. Their names are Andre, Sharif, and Madeline, and they are organizers for the March for Medicare for All. Hey guys.
Hi, everybody.
Hi, everybody.
All right, so why don't we just take turns and have everyone go around the panel and introduce themselves? So I guess we can start with Madeline.
Good afternoon, everybody. My name is Madeline. I'm a teacher in Albuquerque, New Mexico, but I decided to reach out to the Movement for Medicare for All and organize a march here in Albuquerque. So that's me.
And Sharif?
Hey, everybody. So yeah, my name is Sharif Snuggs, and I got into this fight for the March for Medicare for All way last year when Bernie Sanders said now is not the time for Medicare for All. So that really emboldened me to take some action. But not at first. I was like, well, maybe there might be a play here. Maybe there'll be something else that Bernie's probably cooking up. Let's wait and see. And then when forced to vote happened, I said, okay, this is going to be the time that maybe we're going to do something. This is what Bernie was talking about. Now is not the time, but maybe this is the time we're going to do it. And then that didn't happen. And I said, okay, this is not going to work. So I have to do something. So Ricky Rance, a friend of mine from here and also in New York, I talked to him about let's do something, let's do a march, and then it snowballed into what we are right now, which is like a growing big movement where a bunch of us across the country are now coming together to do this march, and I'm really excited.
Awesome. And Andre?
Hello, everyone. My name is Andre. I worked on both Bernie Sanders campaigns, and between them, I really wanted to find something that I could work on that was sort of like what Bernie Sanders was talking about, but closer to home. So I got in touch with an organization called Whole Washington that was basically trying to pass a statewide version of Medicare for All in my home state, which I thought was super exciting. So I've been organizing with them ever since. And in 2020, I was a Bernie Sanders delegate at the national convention, and we were part of a coordinated action to vote no on the party platform because it didn't include Medicare for All. And really, in the years that I've been working on it, I've really seen the movement grow and have multiple really big moments. And I can tell you that right now we're having the biggest moment since I got into it. So it's all really exciting, and I'm really happy to talk about it today.
Awesome. So before we get into the logistics of the march and everything, for people who are not aware, Can you explain, like, how did all this transpire? Like, the first march I heard about was the one that was going to be based in Washington, D.C. But I guess we can start with you, Andre. Like, how did all this come together in reference to organizing the march?
Yeah, well, I'll probably pass that actually back to Sharif in just a moment, but I did forget to mention that I am organizing the Seattle March for Medicare for All. And yeah, it really just happened because one of the activists I work with, Laura Fielding, she has an organization called Red Berets for Medicare for All, and there are these craftivists that knit these hand knit red berets, and they sell them, and that money goes to fund our ballot initiative here in Washington. So she's been doing that, and she's very prolific on social media. She makes a lot of connections, and so she got in touch with the folks who were organizing in DC. I think DC was the first march being planned, but she basically asked if I would be interested in hosting one in Seattle, and I never say no to a call like that. So I suddenly found myself hosting this march, which is something I'd never done before, but I'm doing my best to organize it. But yeah, I do want to pass it back to Sharif because I think he could tell you a little bit more about how the really early organizers started before it got to Seattle.
Yeah, I want to echo what Andre just said about Laura being a craftivist and being really big on social media because that's how I found her. Um, when Ricky and I and it was a 5-person team. It was my friend Ricky, this other young lady named Edie, my friend Dan, and my other friend Tony. Um, I met them through me joining different groups because I've never done this before. I was not an activist. I'm not an organizer. I'm new to all of this. So I reached out. I went to the Moving Front People's Party Slack. I went to Rise and Resist meetings. I went to whole Washington meetings. I went to different our Revolution, DSA, Sunrise Movement. So I went to different groups trying to see what's the next step after forced to vote. What are we going to do? So that was my first initial response. Let me join these groups. Let me join the forced to vote Slack. Let me see what other people are doing. Is there any ground game for this? And I saw that there was nothing going on. There was no ground game. There was no movement. There was no nothing. So when I brought it up to Ricky and said, we got to do a march, we got to do something because no one else is doing anything, because I was really looking for help. I didn't want to be involved. I really didn't. So that emboldened me to go out there and do something because I didn't see no one doing anything. And Laura was the first person that I saw on Twitter, because I'm new to Twitter as well, that I saw that, okay, this is someone who I want to work with because I love her fire, I love her energy, I love her attitude. I want her to be at DC. Unfortunately, she can't make it to the DC, and that's why I'm really happy about the Seattle March, because she can be there with Andre and promote there. And that's something I've always envisioned too, to have multiple marches across the country, not just DC, because it feels like if you have one march, just my personal opinion, I feel like, okay, you just like one small group angry that you don't have Medicare for all. You know what I mean? But if you have different states, different areas across the country asking for this, you can't say it's just one group. You can't say that anymore because now you're too far out. It's everywhere. And so that's how really it got started. It got started with 5 people, and then 5 became 10, and so forth and so on. And then we're just doing outreach, constant outreach, reaching out to different groups. Like I said before, all the groups that I mentioned earlier, I reached out to them to see if they would get involved. I reached out to whole Washington. Whole Washington did get involved, but it did take a lot of time, and that's not due to the fact that whole Washington wasn't interested. That was just due to the fact that they just wanted to see, you know, all the work that we did already. They want to make sure that we're taking it seriously, and they, because they take it very seriously, and that's really what it came down to. Once they realized that we were serious, it was okay. We want to join with you guys, and that's how it started with that.
Awesome. So one of the things I did want to bring up is, prior to when we came on, you guys mentioned Vermont had actually come close to passing Medicare for all. And I think a lot of people don't realize that when Canada passed it, like, that's how they did it. They did it by province. They didn't do it just, blanket across the whole country. So the state by state way, I think we do have a better shot of getting this done. But I want you guys to talk to everybody about Vermont and like what happened with that, how close they came to that.
Yeah, so we were talking a little bit about this earlier, and yeah, so a lot of people will point to Canada as the example for passing single payer in a province and taking it out to the rest of the country. And Vermont sort of serves this weird opposite place in the United States where a lot of critics of single payer healthcare, or especially critics of state-based single payer healthcare, will say, oh, well, um, you know, it's never been done. We tried to do it in Vermont, but it didn't happen. And so the first thing that I think is worth pointing out in this story is that I, for many years, thought that they had attempted to pass it in Vermont, but it failed. And it turns out that the real story is that they passed it in Vermont. It made it all the way through the legislature, was signed by the governor. It became the law of Vermont. And so I think that immediately out the gate reframes the story as this is possible at the state level. It is politically possible. Um, the place where it failed was in implementation, and that had to do with it didn't have its financing plan sorted out, and basically because it didn't have financing and transition figured out, over the time that it was being implemented, the lobbies that oppose it were able to sort of drum up enough uncertainty about it. Elections came up, and it became an anxiety thing for some of these candidates, like, oh, what do we tell everybody about what's going on? Um, and so ultimately, it came apart. And so, I think we need to learn from that experience. One of the things that I'm really proud about with Whole Washington is that it has a very detailed financing plan figured out. That is not always the case with bills, even bills that get passed. But in our case, we pay for it, and we say exactly how we're going to do it. So so yeah, there's a lot to learn from the many campaigns and the many activists who have worked on this before. And so I'm really hoping that whole Washington can learn from that, but also that everything we're learning in our campaign we can bring to the many other campaigns across this country, the many other activists working on Medicare for All at national or state level. We want to be a part of it, and we want to be as collaborative as we can be, because this is not about whole Washington's bill or Washington State. This is about Medicare for all, and that is a national movement. And so we have to treat it that way.
Agreed. Now, I'm glad that you brought up costs, because that's one of the things that people who are against like Medicare for all, they tend to bring up, is they'll say, oh, well, how are you going to pay for it? Like, how are you guys going to cover that? But sitting here, we all know that Medicare for all is actually going to be cheaper than what we have right now with private insurance. What do you guys say to people that say that? Like, how are you going to pay for it? Or they're going to raise our taxes and it's going to be more expensive.
Melon, you want to go first?
Sure. I would say that we need to reframe their claims. Like, they're talking about it in this one way, and we can talk about it as if healthcare is a right. There are many other countries that already recognize that healthcare is a right. So, I mean, there is money involved, of course, but the other countries already do provide healthcare to all their citizens through taxes, and we basically have taxation without healthcare. So that's what I would say. Do you have anything to add, Sharif?
Yeah, I was going to say, how do you afford not to?
Mm-hmm.
Seriously, how do you afford not to? Like, COVID is a perfect example why we need a national healthcare system. I think a lot of people will look to the fact that, oh, every country, felt the wrath of COVID. Yes, but I would argue that we was a special case because we didn't have any PPE, we didn't have any we wasn't even prepared to even handle anything. And that's because we don't have a national healthcare system. We just don't. We just prioritize everything, and we gotta remove from that concept, and we have to treat it as such as everything else in this country. We don't talk about how we're going to pay for law enforcement. We don't talk about how you're going to pay for fire department. We don't talk about how you're going to pay for parks, how you're going to pay for roads, how you're going to pay for bridges. We never ask that question. It just gets done. We just sign away for it. Oh, we need a new bridge. Okay, we just pay for it. But no one answers that. But when you need healthcare, how you going to pay for that? I wish everyone had the same mindset for everything else. Then I can understand the logic, but they don't. And so that's where we are. I think it's more of a talking point they find on mainstream media.
Agreed. Another thing that a lot of people don't know about that are against it is that your premiums are already expensive. So Medicare for All is actually you will actually be paying less, and premiums go up every year. If you don't believe me, just look at like your pay stub. So you can see like how much they're taking out of like your paycheck for your health insurance premiums. That always increases. The other problem that you run into is that your health insurance is tied to your employer. So if your employer changes the healthcare plan, now you got a different plan, different price. You have no control over that. If you lose your job,
I can speak to that too. So like I work at iPic as a movie theater. So I'm a waiter, so I'm a theater waiter there in New York City. And when the pandemic hit, I lost my job. So I didn't have any health care. So I went for a whole year without being able to go to the doctor if something bad happened. I now have my health care now because I have my job again. But literally I had to be reinstated just to go see a doctor. And then I know exactly what you're talking about when if they change your provider or if you have to pay a different tax or whatever the case may be, your cost goes up. I'm still paying out of pocket expenses too, like when I go to the doctor or my kids go to the doctor. I feel like I don't have insurance because I'm still paying a lot of out of pocket expenses. My sister always makes a joke, but I have nieces and nephews. She says, "You better not need to go to the emergency room." You know what I mean? That's a joke that goes around the house because it's something that we all know we have to pay. We all know that it's just so expensive.
Mm. And for people who are self-employed, because this question did come up, for people who are self-employed and people who are unemployed, would they still be able to get Medicare for All? And how would that work?
100%. 100%. I mean, because right now, I know the biggest question, I think Andre would probably be better at answering this too. Washington has what their ballot initiative kind of covers that. And so I think that we all should kind of echo the same ideology when it comes to taxation and like how we're going to pay for it, because that will cover everyone who lives in that state. The idea that if you're homeless or whatever have you, whatever preconditions you have, you won't be able to get treated. That's something that's off the table, obviously. People who are self-employed, they are going to still be taxed as well, obviously. They pay taxes now, so it would only make sense for them to pay taxes with that as well.
Yeah.
Now, some people, go ahead, Andre.
Oh, no, I was just going to follow up on it a bit and say, yeah, one of the big benefits of it from that perspective is because it's not tied to your employer, right? It doesn't really matter why you might have some change in your employment, right? It could be because you're starting a business. It could be because you are wrongfully terminated, right? There's lots of reasons why you might lose your job. And in a Medicare for All system, we treat healthcare as a public good, right? Not something that you earn because you deserve it through work or something like that. We say that it's something people say healthcare is a human right, but the difference between Medicare for All and many other systems that might be able to achieve universal coverage but still treat it as a commodity, right? The difference is that in a Medicare for All system, you don't treat it as a commodity. You treat it as a public good, and it completely reframes how that system prioritizes patients and how it prioritizes other considerations when making decisions about coverage.
That's a good point. We have a comment in the chat. Greg said that Medicare for All would help small businesses as they would save money on employee plans. So this is interesting because one of the things that came up with the $15 minimum wage is they said that that would be bad for small businesses. They couldn't afford to pay everybody $15 minimum wage. But if we have Medicare for All and you're not having to pay for employee plans, healthcare plans, that kind of fixes that problem. How do you guys feel about that?
100%, 1,000%. I mean, one of the things that most employers do, they offer you, instead of you getting a raise, you get like these perks. And one of the perks is healthcare. So I don't know. I know what the gentleman said in the comment for. I hear that a lot. A lot of small business owners don't want to pay for the employees' health insurance, which I personally feel should embolden more small businesses to be involved in this fight, because I hear that a lot. But yeah, I agree with that, because now you don't have to offer an incentive for you shouldn't be offering an incentive. You shouldn't be offering like healthcare to your employees in the first place. That's not something that should be like an option. It shouldn't be there. You should be paying your your employer who's essential, because we can't remember we're essential workers, right? So we get paid accordingly. And the fact that we're not, there's a problem. So
Agreed. I want you guys to talk a little bit about the marches in your location, the ones that you guys are going to be organizing. I'd like to start with Madeline.
Sure. So the way the movement for Medicare for All is working is not a top-down thing. So anybody who wants to be involved in organizing at your location, whatever city it is, even if you want to start a new one, we have the cutoff to be on the t-shirt on June 6th. So if you are from a different city and you do want to organize one, I've never organized before, so this is my first time, and I have already reached out to different groups who are going to get involved with organizing with me. And however you want to do it is fine. It's going to be different in each location. Yeah, so I'm having my first meeting for Albuquerque on May 27th, a Zoom meet. So if anybody out there who is in New Mexico, just go to the movement for Medicare for all.org. It's M4ALL.org. It doesn't have the button for Albuquerque yet, but hopefully we can get that soon. Or you can just search Mobilize Albuquerque M4 and you should find it.
And Andre?
Yeah, so I've been had a couple meetings with the Seattle team. We've been working really hard on a coalition up here. So, we were early with Whole Washington coming on as an official partner of the march. The Red Berets obviously got me in touch with the march, and then Our Revolution Washington. Um, I'm working hard to bring some other groups in as well. In fact, I haven't even announced this to the folks because I've been waiting for it to come up on the website, but I figure here I'm on air, I'm not going to get a better chance. But no, I've just brought on the Seattle Green Party and the Washington State Green Party as partners as well. Um, and just to doubly echo what's been said already, like, yes, the whole point of this is that it's a broadly, broadly unifying coalitional action. So get in touch with us. I'm on Twitter. My DMs are open. If you want to get involved, I want to find a place for you to organize with us, whether that's like, joining a social media strategy or getting involved with one of the marches in a specific locale. Um, and yeah, we're going to just keep growing that coalition, keep organizing. We haven't plotted out a route yet for Seattle, but we're going to be doing it on the same day as everybody else. It's July 24th. So, one of my big considerations that I want to make sure is, I really want to have a route that will be accessible to, the disabled community. I think it's a huge part of who we're fighting for with Medicare for All. It's really is for all of us. We all need healthcare, but that is a particularly neglected kind of constituency within our current system. So I want to make sure that we prioritize that they have access to our march. So yeah, we need all sorts of folks, and I'm really excited to continue to grow Seattle, and as well as doing anything I can to help other cities get their marches going as well.
And Sharif?
Yeah, so I kind of have two jobs because I'm helping the other marchers and I'm also organizing the national march, the DC march, basically. So I will be helping Albuquerque, I will be helping Seattle, I will be helping Los Angeles, I will be helping San Francisco. We have Chicago now. We also have a New York one just came up. We have a New York march now, which I think is fantastic. So I'll be reaching out to everyone who's in who organizing those marches and asking them what do they need. If they want performers, they need guest speakers, they need help with their route, whatever it is. Because DC, we're a little further ahead than a lot of the other marches because we started first. So we have our route secure. We have our location where we're gonna actually have it at. I'm just around waiting to hear back from the national park in in DC. The rally is gonna be at Lincoln Park in Washington DC. And then our route is going to go around it's going to go around the Capitol building and further up to CNN building and go back down to the actual Lincoln Park, where we actually have our rally at. So we have Andre already mentioned a lot of other different organizations that are going to be in from Seattle and in Washington State. but we also have Maryland. We have a coalition in Maryland, so it's going to be working with us in DC. We have my mind just drew a blank because there's so much going on right now. We also going to have people helping out with buses and getting people bused to go to DC, which as well. We also have Marilyn Williamson now. She's going to be a keynote speaker at the DC March, which is fantastic. Savage Joy is going to be like more or less the MC for the actual march. She's actually been taking on the reins as being like an organizer now. So she's actually part of the family. She helps organize. She comes to our meetings. She's super, super supportive. Super helpful. I learned so much from her. I learned so much from Laura and other different people in the group. So yeah, we're gonna have a blast. It's gonna be really fun. Scott Janoyers, he's also gonna be a speaker. He's also being very helpful as well. So yeah, we're right now. I'm more or less focusing on helping the other marchers because we have a lot of things in place already, and so my goal is to make sure that all the other marches are secure. Oh, Portland, I forgot. We also have a march in Portland now too. So I forgot to mention that as well. I did an interview yesterday in regards to that. And they was on with me in that regard. So that was fun. But yeah.
Awesome.
Yeah.
One of the things that I was going to mention, like, so we don't have one in Boston yet, but honestly, I could reach out to Act on Mass. I interviewed them. And I interviewed Erica Eiderhoven, and she started that organization. But I can reach out to them and see if this is something that they're interested in doing.
Sabrina, I love you already. Please, yeah, seriously, fingers are crossed. That'd be awesome.
I think there's a little bit. Yeah, so I think what I'll do, I'll reach out to them definitely because they're really like into like activism as well. So I can do that. I would do it myself, honestly, but I'm mad busy. Like I'm just so like even today I was like, oh my God, I have all this stuff to do. So I'll touch base with them.
I would definitely recommend, and I said this in the very first March for Medicare for All meeting. Work with organizations that have people on the ground. DSA.
DSA. Could you meet?
But yeah, if you just get the attention of a Sunrise or a DSA or whatever, it can kind of start to self-organize, right? And they've got a lot of people. They know how to do this kind of thing. So, it can take a while to get the right person's attention, but once you do, things can really start happening.
Yeah, I was gonna say if they get the ball rolling, you come on as a guest speaker.
Me? Oh my gosh. I would have to practice, but I could do it.
I think you got it.
Okay, we have a comment in the chat. This is interesting. If it passes, how do you ensure that future conservative / neoliberal politicians don't tear it down with budget cuts? Good question. Which one do you want to take that one?
They're going to try that anyway. They're trying to do that with Social Security. But I think that it's going to be really hard to get rid of Medicare for All if one state gets it, and especially if it's working in that one state. Forget about it. There's no way you're going to pull that away from people. It's impossible. I don't care what conservative, what neoliberal try to say or do. Once one state, all we need is one state to do it. Once it passes, it's over. It's the floodgate is open.
Yeah, and to add to it a bit, we do often talk about how in conservative, in Western Europe, Scandinavia, right, they have conservative parties, but generally speaking, those conservative parties, they're pretty deferential to the healthcare system because their healthcare systems are popular. They are providing healthcare to millions of people, huge percentages of the population, and so it completely reframes the conversation, right? It becomes, hey, this guy is trying to take away all of your guys' healthcare, and that's like pretty hard thing to run on. It's like people don't. You can kind of get away with it in the United States because the system is so complicated, and like a ton of people who thought that they lost their healthcare plan because of Obamacare, like they weren't on ACA plans, but it's just because the waters were sufficiently muddied. But with a public healthcare system, especially a universal one that's covering everybody, it's like everybody is in this system. They have a relationship to it, and so therefore they have expectations of it, and it becomes harder to take it away from them.
Yeah, and this kind of reminds me too of when they started legalizing cannabis by the states. And so I'm in Massachusetts. It's not only just legal here, but you can buy it here. There's shops and like everything. But look how it's starting to spread across the country. Like all of these different states now are legalizing it. So I think you're right. Once like one state like gets this passed, it's only going to be a matter of time before other states are like, we need to do this too.
My prediction is 10 years. I think within 10 years, we're going to have every state is going to have Medicare for all. It'll be a national issue. It'll be a national for sure. Guaranteed.
What do you think, Andre?
There's a
He's not a gambler.
degree somewhere that says information science, and it's like I'm not supposed to make predictions about the future. It's like the one thing I remember from college, like don't predict the future.
It'll be interesting to see. Like I said, I feel like the West Coast always starts like they get a jump on things.
And what I'll say is here in Washington, right, we're pushing super hard for it. We got our ballot initiative this year. We're collecting signatures from May to December. I think we got a good chance. It's a big lift. It's based on the turnout of the last presidential election, which, as you all know, was very high. And in addition to that, we got most of our signatures the first time we ran this ballot initiative at big festivals and gatherings. And even though a lot of people are getting vaccinated now, we still don't have as many of those. On the other hand, our organization has grown a ton. And we have a much bigger window this time because in the past, we did a different kind of ballot initiative that just gave you a couple of months. And this time we get basically like half a year. And so, I think we've got a very good chance of passing it this time. But if it doesn't happen this time, next year where there's no COVID and we'll have had this giant march and the movement will have grown as a whole, I think, we're really going to have a great chance. But I think the first state, I will say, I think it's completely possible that the first state could happen within the next, 2 to 4 years. And at that point, I think 10 years is, it was 10 years for Canada. And I think the first state's the hardest. It's the biggest question, the greatest chance of failure. But once you pass that first one, the second one is so much easier. Like, let me tell you. And I think that I think it could really cascade.
Yep. There's a question in the chat about the Red Berets. Do we need more crafters to create that for Medicare for All? That's directed towards you, Sharif.
Oh, I was going to say we always need more crafters. Whole Washington will never tell you no, because I can't begin how much manpower that takes to make one. You know what I mean? Mm-hmm. It's a lot of work. It's a really lot of work. So if they have extra hands, they're not going to say no because there's a lot of work for sure.
Yeah, and just to add to it a little bit, the Red Berets is it's a type of activism that is designed to be worn. It's designed to get attention. So really, the more than we knit, the more people that see them, the more people that you get to have these conversations about, where you're saying, hey, I'm wearing this red beret because I support universal health care. And if that sounds cool to you, maybe you should get one too. And so I really think that, the more crafters that we have, the more berets that we have out there, the more of these conversations that we're going to have. And so they're designed to be something that changes a narrative and that brings sort of a visual aspect to this movement so that it's something that is harder to miss, harder to ignore.
Agreed. So you guys know that Kenny Ballantyne is making a documentary, a healthcare documentary right now. He's going to places across the country interviewing different people. I'm not sure when that will exactly come out, but I just think that's another added like bonus to like this movement.
Yeah, he's interviewing us actually. Yeah, we're gonna be added to the documentary on the March for Medicare for All. So I'm really excited about that. Yeah.
Yeah, it's a complete game-changing thing. Even 2 years ago, I had not heard anyone suggesting that, this movement was at the point where, it was ready for a documentary to be made about it. Nobody was talking about that idea. And yeah, it's kind of coming out on an ongoing basis in that he's making this documentary, but he's also a part of the movement. And so he's, releasing materials that he gets from his interviews to help us build visibility for the movement. And I don't know when it's going to be turned into like a proper, documentary that hopefully we can all stream on Netflix. But I think when it does, that will be yet another huge milestone for the movement. That's like a level of, you know, access to eyeballs that we just haven't had.
Agreed. Now, I know some people have asked questions about what happens if this passes. Will they still get to keep their doctor that they have? Or is this going to affect like their prescriptions, things like that? Can you guys answer that?
Yeah, I'll go ahead and answer because that mostly applies to Washington since we have the bill right now. Although there is one in New York as well, I suppose. But yeah, in Washington, it's really designed to be a universal healthcare system, and so uh, the everyone's going to be on the same insurance plan, right? And that means that it's going to be an incredibly, it's sort of like collective bargaining, right? So it's a huge insurance pool that any healthcare provider would be able to get a huge amount of customers for, essentially. I mean, this is getting a little bit more into how healthcare policy works, right? We're not talking about uh, making a public health delivery system, right? We're just talking about public health insurance. So we're still talking about private hospitals, private doctors, and by accepting the public health insurance, what you're saying is, I'm accepting an insurance plan that literally everyone in the state of Washington could be one of my patients, right? So it's like, um, it's a huge part of how they're able to get good prices is because they have a huge amount of negotiating power. And so they're going to be applying that negotiating power to the healthcare, doctors, hospitals, and we expect that you'll be able to basically go to any doctor and hospital. It will be covered by the plan, um, and you'll have way more choice than you typically have with your private insurance, which you might have a doctor that accepts your insurance now, but anyone could take that away, right? The doctor could, the insurance company could, the hospital could, your boss could, right? So I don't know that I don't predict the future, but this is going to be, I feel confident in saying it's going to be way more stability than folks are used to from private insurance. Way more stability.
Yeah, I was gonna touch on a point that Andre had made about the fact that you can always lose your doctor. I mean, seriously, we talked about this earlier that, with my job, if I change my healthcare provider, I have to go wherever that provider provides for whatever hospital I go to. So let's say if I have Blue Cross or whatever, Blue Cross doesn't cover the hospital I want to go to, then I can't go to that. I can't see my doctor anymore. So you have that system now. Everything's in network now. So chances are, you're gonna be in a better situation because the whole Washington plan is to get everyone covered, every hospital, every doctor, wherever you live, whatever situation is, you're gonna be covered. Now we don't have that. Like I'm just speaking of me personally living in New York. I'm trapped to wherever my health insurance is. Like, so I cannot move outside of network. So I'm stuck wherever I have to go see whoever doctor takes my insurance. That's it. So that's the difference.
Yeah, it's also an issue when you move too and you haven't actually started working at your new job yet, so you don't actually have that new health insurance yet, but you're in that in between period and God knows none of us want to pay for Cobra cuz it's ridiculous. So what happens is if you end up having to go to the doctor or have to go to the hospital, now you're stuck with the bill. And not to mention that I know people that have or what they call great health insurance, but they still get hit with large medical bills. And people have actually taken pictures of their medical bills and sent them to me and showing me exactly how much insurance paid for it and how much they still owe. So that's why, like last year during the elections, during the Democratic debates, when people were on the stage and they were like, Bernie Sanders wants to take your health insurance away. He wants to take your health care away. I'm like, no, that was like a right wing talking point that they were using because those people up on the stage get money from pharma companies. So they don't want to give you Medicare for all because those are their donors. So that's the thing I want people to be really like aware of, is that the healthcare system in this country, it's for profit.
Yeah.
It's a mafia.
One thing, so a lot of people who might think that they like their health insurance, right, or they're comfortable, they're a little nervous about the change. One thing that I've found is that people think they like the health insurance system at the time when they haven't had to like use it heavily. Um, so a lot of people don't realize how underinsured they actually are. Um, or they haven't had one of these situations where they have a gap. I mean, these coverage gaps you're talking about in the past have been used to be like, oh, well, because you had non-continuous coverage, that becomes an excuse for us to jack up prices on you. All sorts of ways, right, that they don't apply to all people at all times, but it's when you need it at the critical moments that it falls through for you, right? And so and and right, it's true. The American people are healthcare policy is complicated. It's stressful, and so as a consequence, a lot of Americans they don't know anything else, right? They couldn't tell you how other countries do it. All they know is the current system, and they're not entirely comfortable with it. But so we really need to help educate people to understand what the situation is. And I think that's something that the American people are still kind of learning about. I think COVID helped reveal that for a lot of people, just the obvious flaws with it. Um, but yeah, when the time comes, there will be an enormous propaganda campaign against what we're doing, and that's when we get to really test. Have we engaged with the American public enough on this? Are we powerful enough? Are our voices strong enough to break through that lobby and the many resources that it has? So you know the, and people will use this as a reason for why we can't do a statewide campaign, why now is not the time. The only thing that I can say is that lobby is only ever getting more powerful and it's not going anywhere, right? So at some point we have to say that we need to take them on and win. And so I don't really think that I think it's one of those situations where the best time really was 20 years ago and the second best time is now.
No, I agree with Andre 100%. That's one of the biggest reasons what pushed me. It was the fact that I felt that we don't fight now, we're never going to get it. I really believe that. I don't think that there is a later. I think if we didn't realize that we need Medicare for all during a pandemic, we're never going to realize we need a Medicare for all. I think to Andre's point about educating folks, that's why March and a rally is so important. Because when you have a march, you have a rally, you have a chance to build not just coalitions with the organizations or different groups or different organizers you're working with, but you get a chance to meet people who don't even know anything about Medicare for all, don't even know about how the system works. I did a protest in DC a little couple of weeks ago with Cochetta to fight for immigrant rights in this country, and you'd be surprised at how many people in DC not only just came to find out information, but joined the march and joined the rally. People just didn't know. And so that's what March is about. A lot of people ask me, what is a march going to do? What is a rally going to do? What does that mean? And so I explained to them that that's what that does. It educates people. It really fills them in a lot of information, more information that I know. We are going to have some tabling. We are going to talk about the initiatives at every March. We're definitely going to talk about statewide. We're definitely going to have people there who can give them the better answers that me and Andre can give. This is why this is important of having that, because we want to have the experts there. If anyone has a question, you can go to the website now. But for those people who don't want to go to the website and they want to speak to a person, those people will be at the march. at all the marches we're going to have, people are going to be there to answer all the questions in regards to that.
Yeah, there's a question in the chat that says, when I switch jobs, I never know how much I'm going to pay for health insurance at my new job. Dude, no, that is another problem. That's a huge problem.
That's a fact. That's a fact.
And I'll just add a little something to that. I literally do talk to people who will say things to me like, no, you don't understand. I don't pay for my health insurance, right? My employer gives it to me. And we need to make sure people understand and reframe this as like, that is coming out of your paycheck, right? They have found a way, it's accounting tricks to hide the cost, to hide how much you could be making, right? And to make you accept things the way that they are, but it's not what's happening.
Agreed. There's a question, who is the leader in this fight? Guys?
Oh, it's easy. The American people.
Yeah, I'm really glad.
The American people.
Yeah, I'm really glad that somebody asked this because, I and Sharif has actually spoken to this more than I have, I realize, but no, I also have that experience of going from looking up to certain people and feeling like there was this movement with this leadership and that I had to follow that leadership. And at a certain point, I realized actually, there are a lot of people who want this, and there have been people who have stepped up. There have been people who, at times, kind of look like they're maybe leaders of the movement, or it's a movement with many leaders. But the unfortunate truth is, and I want to say this in a way that motivates people rather than depresses them and causes them to stay home, but there's less leadership than I realized, and it is one of those things that helped me realize that, um, you know, that I needed to be the leader that I had hoped other people would be, that it comes down to all of us. Nobody is going to just come and figure this out for us. And so that's what we're doing now, right? It's I wasn't doing this 4 years ago, right? Because I was trying to get somebody elected to do it for me, right? And now we're just doing it.
Yeah, no, I agree. That's the only thing about having something like this, a movement attached to an election. Because if, Bernie definitely like led the way on this. And if Bernie would have won, who knows, we could probably already have this right now. But at the end of the day, when you tie like a movement to an election and that person does not win, who do you have leading that movement like after that? So if you look at the really popular movie, well, not popular, I take that back. The successful movements that we've had in this country, civil rights movement, women's movement, they weren't tied to an election. And I think that's one of the reasons why it was so successful, because even like the civil rights movement was not popular. But it still worked. So I think this is the way to go, like having the people like lead this and doing this state by state and organizing all these marches for Medicare for all, instead of relying on Joe Biden to do, because he's just not going to do it. He gets too much money from pharma. So we have to like stand up and like fight for this ourselves.
Yeah.
No, 1,000%. I was going to say, go ahead, Andre.
Oh, yeah. I was going to say that, actually, Sharif, you should take it because I've trailed off here.
No, I was going to say 1,000%. And the fact that Sabrina, you said that elections kills movements. I agree with that 1,000%. I was telling people that look what happened when Bernie dropped out. There was no ground game for Medicare for All anymore, and that just proves that movement moves people. People don't move movements. You know what I mean? Like, people want this, and so when we win it, because I don't say if, when we win it, because we are going to get Medicare for All. It's because of the people, and it will be unfortunate that someone else will get the credit, but every American who's fighting for this, they're the reasons why Medicare for All will be enacted. Would not be Joe Biden, would not be Nancy Pelosi, would not be Chuck Schumer, would not be any of these people who who abandoned us. It'll be the American people who pass a ballot initiative in their state to get Medicare for all. That's who's going to be. Those are going to be the unsung heroes of this fight.
Yeah, and I was gonna add to that, you know, the whole like idea of we could elect Bernie and he'd do it for us. The truth is, I thought that Bernie was very honest with us, which was that I always understood it as we were going to get him in so that he could help us, he could lead the way, but that he would still need all of us marching in the streets for Medicare for all, right? And it's kind of some of those classic quotes about, um, I wish I could remember the context better, right? But it was like the president saying, "Now make me do it, right? Get out there and make me pass it, right?" So we can't expect anyone to make the demand for us, right? This is about our own lives, right? Our own like self-respect. We need to get out there and say that the demand is coming from us.
Agreed. All right, guys, I have one more question for you. For people who do want to get involved and may want to organize in their own city, how can they go about doing that?
Andre, you want to go first?
Yeah, well, I guess what I would say is if you go to m4all.org, you can get in touch with the organizers. There's an email list. There are cities, and uh, you can sign up for one. If you want to get involved with organizing, you can send me a DM on Twitter. You can get in touch with Sharif, I'm sure. Um, you know, there's also the M4 All Twitter. Basically, you know, reach out and say that you want to be involved in the organizing. We'll get you set up. And there's a huge spectrum what it means to say, you want to be involved with organizing. So we're still setting up kind of a process for getting folks in and getting them to the thing that they'll be working on. But if you get in touch, we're gonna try to find something that will be really exciting for you to work on.
Yeah, and even if people don't want to organize, they can volunteer. I said this on this other show I was on yesterday. We're gonna need people to help set up. We're gonna need people to help clean. We're gonna need people do some marshaling. We're gonna need people to if you're a medic, we need volunteers just in case something, God forbid, anything happens at any of these marches. If you live in Seattle, if you live in DC or New York, wherever, there's tons of things you can do. If you're a videographer, you're a photographer, there's thousands of ways you can get involved. And yeah, if you go to m4all.org, or you can DM me on Twitter. My DM is at I am for Medicare for all. You can definitely DM me. Yeah, and we'll get you set up.
There's one more thing I wanted to ask everyone to do, which is all of you out there who are a part of organizations, even if they're not healthcare organizations. So, like here in Seattle, I'm trying to work with Sunrise. But if you're a member of an organization, you're excited about this march, even if it's not in your city, we need as big a coalition as we can. So, if you go to M4All/partners, you'll see we got a few partners. I want that page to be so full of partners, you're like scrolling to get through it. So go to those organizations that you're a part of, tell them about the march, ask if they're willing to pass a resolution or whatever process your organization does to come on as a partner. It doesn't commit you to anything, right? We would love to organize with you. So if you want to be that kind of partner, then like, yes, get in touch and you can organize a march in your city or one of the cities that currently exists. But even if all you want to say is, hey, we as an organization support this march, and we want everyone to know that. It makes a huge difference to us because every organization that we come to, then we can say, well, look at all of these people who support what we're doing. Don't you want to be a part of it? And so it's a big way that we can make it a really inclusive action.
1,000%.
Awesome. Guys, thanks so much for coming on to talk to everybody about this. I'm trying to get the word out as much as possible. I will contact Act on Mass and see if they would like to get involved as well. But other than that, thanks so much, guys.
Thank you. So nice to meet you.
Thank you.